Welcome to another edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features presentations on opioid use, medication management, recovery, and health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Council on Recovery's Welderly Program. Today, Rosanna Ishii, Older Adult Specialist for the Welderly Program, and Leah Bell, Older Adult Coach for the Welderly Program, will provide part one of a three-part series titled Medication Reconciliation. At this time, please welcome Rosanna Ishii and Leah Bell.
Hi, how are you?
Hi, Leah. How's it going?
I'm good. How are you?
I'm good. Thank you for being here.
Yes, we thank you for tuning in.
So what do we have planned today?
Well, we're going to talk about reconciliation part one.
And so again, it's a three-part series,
Mhm.
and this is the first part.
Mhm.
So how do you want to go ahead and start?
Well, I'd
Leah?
like to start off with a statistic. The fifth leading cause of death amongst older adults is due to adverse drug interaction, which claims 7,000 lives per year. That's
Those
why
are,
it's
yes, those are huge numbers.
And that's why
Leah.
it's very important that we always follow medication adherence.
Yes, and along with that, we will cover drug interaction, medication error. We're also going to identify ways that we can manage our medications, which is also another word for medication reconciliation. And so we're also going to be covering documenting, storing, and disposing our medications. And we're going to briefly touch on Medicare Part D, prescription coverage.
Okay, so medication adherence, it involved getting your prescription filled as directed. It's remembering to take your medication, the correct dosage at the correct time. And it's also understanding the directions from your physician as to how to take your medication. So now if you have a problem with understanding language barriers of sorts, it's advisable to take someone with you to your doctor so that they can be sounding board or scriber for what your doctor is elating to you.
Mm-hmm. Yeah, and medication adherence is so important for a number of reasons. For example, some of us have multiple physicians who may be prescribing multiple medications, and we may also, some of us might have problems taking the medicine correctly, either because of depression, self-neglect, or even alcohol use, and also memory problems.
Yes. Yeah.
Right?
You know, I've had problems remembering to take my medication from time to time. So what I've done is set an alarm on my phone to remind me to take my medication.
Yes, having little helpful tools
Yes.
is a good idea.
And that's one.
Yeah. And otherwise, these type of issues can cause serious side effects. For example, allergic reactions, toxicity, and it can even decrease the effectiveness of the medications.
Another error, which could due to medication error, could be confusing eye drops with ear drops, chewing non-chewable medication, or cutting and crushing. So medications that are okay to cut has a little score on it, which is just a little indenture on your on the tablet, that straight little line. That's indication that that's safe to do so. Otherwise, do not. By chewing, cutting, or crushing a medication that is not designed for such methods would cause poisoning, which could also lead to an adverse drug interaction.
That's some really good information, Leah. And another example of a medication error would be, for example, you are under the care of a physician for some reason. Say you have a toothache or some type of pain, they prescribe you Tylenol 3. And without thinking, you end up taking Tylenol for another reason at home. Say, for example, you have a headache. And actually what that can do is put you at risk for liver damage by having too much acetaminophen in your system.
Well, that would be such as duplication of medication, which can also cause an overdose. Yes. So Rosanna, how can we prevent that?
Okay, well, as with all things, knowledge is the best defense.
Okay, so what you're saying is to know what the brand or generic name of the medication is,
Yes.
what you're taking it for,
Mhm.
and how long should you wait before you see a result of that medication.
Mhm.
Knowing what time to take the medication, how long you should take the medication, what happens if you miss a dose. Should you skip that medication that time, or should you take it? Some medications have a window of time where you can take the medication if you miss that dose.
Yes.
But some will say just skip that dose altogether.
That's right.
Also, what you should do if you accidentally take more than you should have
Mhm.
prescribed.
Yeah, and along with that, some other things to ask yourself: should you be avoiding any certain types of foods, drinks, or other medications that could interact with your prescription? And also, sometimes they can even tell you take with milk or on an empty stomach. Some of them will also have clearly directions on the pill bottle itself to avoid machinery or driving and avoiding alcohol.
Yeah, and some food can interact with drugs adversely, like citrus. Some medications will tell you do not consume citrus products, or like a topical cream, it may advise you not to go out into the sun, so you don't want sun exposure. So it's important to follow all those directions, right, Rosanna?
That's right.
Okay.
And definitely knowing the side effects
Yes.
with the medication.
And the precautions, yeah. So do you want to explore the storing steps for storing your
Sure.
medications?
Sure. So as far as storing your medications, you want to be sure it's in a safe and secure place, which will help to avoid things like theft, abuse of the medication, accidents, or even tragedy.
Okay. Especially if you're living with children, adolescents, or even other adults, you may want to lock them up. Okay, so proper ways to dispose of expired or unwanted medication would be to return it to your pharmacist. There's also a program called the Drug Take Back Drive, which is held here at the council 2 times out of the year. There is an option of a sealable pouch which contains active carbons, which when the medication is put into that active carbon, it breaks the binds in that medication to render it non-potent. You just seal that pouch up and you can just throw it in your household garbage. It's safe to do so. I would like to say never, never, never flush your medications down the toilet or down the drain unless the label specifies that it's safe to do so.
That's right. And another option would be to mix something that's not very desirable, such as used coffee grounds,
kitty
litter, and just putting that in a sealed bag and with your medication that you're going to dispose of, and just toss it in the trash.
Yes.
And then with your prescription bottles or prescription bottles, just go ahead and cross out the personal information for your protection.
Yes. Okay. So let's move on to how to manage your medications. Well, one way is to consistently review your medications. That includes over-the-counter medications, that includes vitamins, that includes herbal supplements, because your doctor may need to adjust your medications depending on your having multiple conditions. You may want to prescribe specific and different medications for each of those conditions. Yes. Okay, so now with all that being said, let's talk about specifically medication reconciliation. What is medication reconciliation? We're glad you asked.
We're glad you asked. So what medication reconciliation really comes down to is a safety strategy. It helps patients keep safe by managing their medications. And so what you do is you compare the list, what you will do is compare the list of your medications your healthcare provider has on file for you with the list of medications you're actually taking. And again, this helps to avoid medication errors such as dosing errors, drug interactions, duplicate meds, and even missing the medications you should be taking. So, and we mentioned that briefly earlier.
And medication reconciliation, like you said, is a safety plan, and it is operated through verification, clarification, and reconciliation. Verification is simply collecting a list of medications that you're taking, along with all your medication history. Clarification, ensuring medication and dosages are appropriate for the patient. Doctors start with what is called slow and low, and this is a method where the medication is given to the patient at a lower dose, and it is increased as time goes by if needed, and is adjusted or even change the medication altogether. So it is customized for the patient, specifically for that patient. So that is why it's very important never to share your drugs, your prescription drugs. We will discuss that in another topic later. And the final strategy of medication reconciliation is the reconciliation part. This resolves any problems or discrepancies that there may be between this medication. And so the pharmacist would then make a new order, or if everything is okay, then
and as far
it would follow through.
And as far as the medication reconciliation and keeping the log, it's all about being proactive.
Exactly.
And so you want to do your own research, know the name of the medication you're taking, know the dosage, possible side effects, and know why the medication is being prescribed in the first place. And it's your right to reach out, ask questions. Your physician or pharmacist, you can ask them any specific questions that you might have. It's important to take charge of your health.
You're right, Rosanna. You know, there's another way you can be proactive, and that is by having a personal medication record, which is like a log that lists all your medications. It tracks your dosage and the frequency of use. You want to keep your record updated, and also share with your personal primary care physician. Yes, and your pharmacist, and also your care provider.
That sounds like that can really be something handy for you to keep with you.
Yeah.
Right, Leah?
And also another thing, medication, having a medical record is advisable. This record is a written history of all your medications, your immunizations, your allergies, and your medical and family health histories. To be accurate, you can also, like you said, you have your rights to have your medical record given to you by your physician. And by doing so, check and review it to make sure there's no mistakes.
Yeah, and keeping the logs that you were mentioning, that can be either done electronically or manually as well.
Yes.
So all this is easily done through medication reconciliation, which is why we are currently doing this here at the Council on Recovery in collaboration with the Harris County Agency Area on Aging, otherwise known as AAA. And even though our elderly program is geared for 60 and above, this medication reconciliation program is for anyone 45 and up. And did we say it's free?
Yes, it's
absolutely
free.
And confidential.
Free, yes. So now what this program does, with your permission, of course, is provide a list of medications to a licensed pharmacist who will review your medications. This list would also include the medications that you're taking, the dosage, who prescribed the medication for you, the date that the medication was prescribed, and the pharmacy that prescribed it. The pharmacist will then collect this information, review it to see if there's any discrepancies or adverse effects that could occur behind taking them all together.
And again, it brings it all back to being the safety strategy
Yes.
to keep you
And
safe.
again, the goal is to keep you safe and healthy and to decrease, if not eliminate, that staggering number of 7,000 deaths each year due to adverse and drug interactions.
That's a number that really is, we can bring that number down.
Yes. Yes.
And so very briefly, should I go ahead and touch on Medicare Part D?
Yes, that would be nice.
Okay, so it's all about drug coverage, and I just want to mention a few websites in the event that you would like to do some checking yourself, and that's medicare.gov, mymedicarematters.org, and benefitscheckup.org.
And if you didn't get all of that, that's okay. You can call the United Way referral line at 211. So would you like to wrap up a little? We'll
Sure.
review what we've gone over.
Okay.
We've shared a lot of information. So one, you want to let your doctors and your pharmacists know, all of them. If you have multiple doctors, you should share this information with each and every one of your doctors and each and every one of your pharmacists. All medications you are taking, this includes over-the-counter medications and vitamins as well.
And so don't forget, prepare your medication record, add and remove your medications from your records as needed. And also get help with Medicare Part D prescription drug coverage if you need to.
Take all medications to your pharmacy and to each one of your doctor's visits.
And please participate in our medication reconciliation program.
And stay healthy.
Thank you. This concludes our presentation for today. We will be having another series of senior talks. We look forward to presenting. Thank you.
Thank you.